Welcome to today's NCLEX question bank. Without further ado, let's dive into the questions. 1. A nurse is caring for a client with Addison's disease. Which finding requires immediate intervention? Answer A. Blood pressure of 88/50. Rationale: Addison's disease is characterized by adrenal insufficiency, which can lead to Addisonian crisis, severe hypotension, and shock. A blood pressure of 88/50 requires immediate intervention with IV fluids and corticosteroids. 2. A nurse is preparing to administer IV vancomycin to a client with MRSA. What is the most important nursing action? Answer A. Administer the drug over at least 60 minutes. Rationale: Vancomycin must be infused slowly over at least 60 minutes to prevent red man syndrome, a reaction causing flushing, hypotension, and rash. 3. A client with myasthenia gravis is prescribed pyridostigmine, mestinon. What is the expected therapeutic effect of this medication? Answer A. Increased muscle strength. Rationale: pyridostigmine is a cholinesterase inhibitor that improves nerve signal transmission in myasthenia gravis, leading to increased muscle strength. 4. A client with suspected bacterial meningitis has a lumbar puncture. Which cerebrospinal fluid, CSF, finding confirms bacterial meningitis? Answer B. Cloudy fluid with increased WBCs and decreased glucose. Rationale: bacterial meningitis causes an increase in WBCs, decreased glucose, bacteria consume glucose, and cloudy CSF due to pus formation. 5. A nurse is assessing a client with a head injury who suddenly develops fixed and dilated pupils. What is the priority intervention? Answer D. Notify the healthcare provider immediately. Rationale: fixed and dilated pupils indicate brain herniation, a medical emergency. The healthcare provider must be notified immediately for urgent intervention. 6. A nurse is caring for a client in labor who has severe preeclampsia. Which assessment finding requires immediate intervention? Answer C. Respiratory rate of 10 breaths per minute. Rationale: a respiratory rate of 10 breaths per minute suggests magnesium toxicity, a complication of magnesium sulfate therapy for preeclampsia. The nurse should stop the infusion and administer calcium gluconate. 7. A client with atrial fibrillation is prescribed warfarin, Coumadin. Which statement by the client requires further teaching? Answer B. I can take aspirin for headaches. Rationale: aspirin increases bleeding risk when taken with warfarin. Clients should use acetaminophen, Tylenol, instead. 8. A nurse is caring for a client with a chest tube following a pneumothorax. Which finding requires immediate intervention? Answer A. Continuous bubbling in the water-sealed chamber. Rationale. Continuous bubbling in the water-sealed chamber indicates an air leak, which requires immediate intervention. Gentle bubbling in the suction chamber is normal. 9. A client with chronic kidney disease, CKD, reports severe itching. What is the most likely cause? Answer C. Uremia and high phosphorus levels. Rationale. Clients with CKD experience uremic pruritus due to high phosphorus and toxin buildup. Treatment includes phosphate binders and dialysis. 10. A nurse is caring for a client with deep vein thrombosis, DVT, who suddenly develops acute shortness of breath and chest pain. What is the nurse's priority action? Answer C. Place the client in high Fowler's position and apply oxygen. Rationale. Acute dyspnea and chest pain in a client with DVT suggest a pulmonary embolism, PE, a medical emergency. Positioning and oxygen should be the first intervention before notifying the provider. All right, guys, that is it for today. If you like this video and want to see more like this in the future, don't forget to subscribe to our channel and like this video. Also, we offer many free guides and wonderful resources on our website. So don't forget to check out our website, www.yournursingspace.com. Happy studying!